Have you ever found yourself taking a handful of vitamins in the morning, only to feel tired, stiff, or foggy by noon? It's puzzling, isn't it? You're committed to doing the right thing for your body, you follow expert advice, maintain a routine, yet something feels amiss. Your health seems to decline, even though you're trying harder than ever to maintain it. If this scenario strikes a chord, you need to hear this, because understanding your body's changing needs after the age of 60 is crucial. As we age, the body's ability to process supplements alters significantly. Surprisingly, some common vitamins you've relied upon, those touted as beneficial for seniors, could inadvertently be causing harm. These can silently inflict steady damage that accumulates in the liver, affects the nerves, and even burdens the heart. Alarmingly, these effects might not be apparent until it's too late. But here's the hopeful truth: it's possible to reverse this trend. By choosing wisely, you can avoid potentially harmful vitamins and instead provide your body with what it truly needs to remain sharp, stable, and vibrant every single day. In today's video, I'll guide you through 4 vitamins that are unexpectedly risky after the age of 60, alongside 4 essential ones to integrate daily to help you feel stronger, clearer, and more energized. Stay with me until the very end, because the final vitamin we'll discuss is linked to a staggering 36% reduction in the risk of death in those over 60, according to a comprehensive European study. This single change could signify the difference between merely aging and truly thriving. During our exploration, I'd love to know where you're tuning in from today. Feel free to share it in the comments below. Additionally, if you've ever felt perplexed about which supplements are beneficial versus potentially harmful, let's open a dialogue about it. Alright, let's delve into the first vitamin that might be doing more harm than good, even though most seniors are taking it daily. In this in-depth analysis, we'll factor in scientific insights to illuminate these critical choices. Part 1. 4 dangerous vitamins after 60. Vitamin A. Retinol palmitate, is common in multivitamins and often praised for its benefits to eye and immune health. As an essential nutrient, vitamin A plays a crucial role in maintaining good vision, supporting immune function, and promoting healthy skin. It's no surprise that it frequently appears in multivitamin formulas and is widely marketed as a must-have supplement, especially for aging adults concerned about vision loss or weakened immunity. However, vitamin A is a fat-soluble vitamin, which means it doesn't flush out of the body as easily as water-soluble ones. Instead, it accumulates in the liver and fatty tissues over time. This poses a concern, particularly as people age and liver function tends to decline. The body becomes less efficient at processing and eliminating excess vitamin A, increasing the risk of toxicity. Vitamin A toxicity can manifest in various unpleasant symptoms, including dizziness, dry or peeling skin, and persistent joint pain. More serious consequences include potential liver damage and a higher risk of atrial fibrillation, a heart rhythm disorder that can lead to strokes or heart failure. These risks underscore the importance of not overdoing vitamin A intake, especially from supplements. A safer and smarter approach is to get vitamin A in the form of beta-carotene from food sources like carrots, spinach, and sweet potatoes. Beta-carotene is a plant-based precursor that the body converts into vitamin A as needed, significantly lowering the risk of toxicity. This way, you gain the benefits of the vitamin without putting unnecessary strain on your liver or risking long-term health complications. Vitamin 2. Iron. Iron is a crucial mineral, especially for younger adults and menstruating women. It plays a vital role in transporting oxygen through the blood, supporting energy levels, and maintaining healthy cells, skin, and hair. For people in their reproductive years, particularly women who lose iron during menstruation, iron-rich diets or supplements can be essential in preventing anemia and keeping energy levels steady. However, as we age, especially past the age of 60, the need for supplemental iron decreases significantly. Most older adults no longer experience regular blood loss, so the body retains more of the iron it absorbs. This can lead to a condition called iron overload, which occurs when excess iron accumulates in organs like the liver, heart, and pancreas. Iron is a double-edged sword. While necessary in the right amounts, too much iron acts as a catalyst for oxidative stress, producing free radicals that damage cells and tissues. Over time, this can contribute to serious health problems, including liver damage, heart disease, insulin resistance, and even cognitive decline. What's especially tricky is that the symptoms of iron overload, fatigue, joint pain, and memory problems can easily be mistaken for normal aging, allowing the condition to go unnoticed for years. This is why it's important for older adults to think twice before taking multivitamins with iron, unless there's a clear medical need. The best course of action is to avoid iron supplements unless you've been diagnosed with iron deficiency anemia. A simple blood test can reveal your iron status. Ask your doctor to check serum ferritin and transferrin saturation levels. These tests can help determine whether you're absorbing and storing iron properly or if there's a potential risk of overload. In the absence of anemia, getting your iron from whole foods rather than pills is usually a safer and healthier approach for aging adults. Understanding calcium supplementation and managing its risks. Calcium is widely recognized for its crucial role in promoting bone strength and maintaining overall skeletal health. It's a fundamental mineral the body uses not only for building and maintaining strong bones, but also for muscle function, nerve transmission, and hormonal secretion. However, the relationship between calcium intake, supplementation, and overall health is more complex than it might initially appear. This complexity arises particularly when calcium is taken in isolation or in excessive amounts. Let's dive deeply into understanding these dynamics and explore how to safely incorporate calcium into your regimen. The potential risks of calcium without proper balance. Calcium's benefits are clear, but its misuse can lead to unintended health risks. Arterial calcification. When calcium is consumed without adequate consideration of other essential nutrients, it can accumulate in the wrong places. One major risk is the potential for calcium to deposit in the arteries and soft tissues, rather than in the bones where it's needed most. This can lead to arterial calcification, which may contribute to cardiovascular diseases by causing the arteries to stiffen and narrow. Increased heart risk. Scientific studies have suggested links between high calcium intake, particularly from supplements, and an elevated risk of heart events such as heart attacks and strokes. These findings have prompted widespread calls for a more balanced approach to calcium supplementation, especially among older adults and those with existing heart conditions. The role of companion nutrients, vitamin D3 and vitamin K2. To safely and effectively benefit from calcium, it's crucial to pair it with vitamins D3 and K2. Could weaken bones rather than strengthen them. Vitamin K2, less well known than vitamin D, vitamin K2 is vital for directing calcium to the bones and teeth, ensuring that it stays away from the arteries and soft tissues. By activating proteins that regulate calcium deposition, K2 functions as a guide for calcium to be used appropriately within the body. Safe and effective sources of calcium. Obtaining calcium from dietary sources is generally considered safer and more effective than relying on supplements alone. Here are some calcium-rich foods that provide the mineral along with other beneficial nutrients. Leafy greens. Vegetables like kale, collard greens, and spinach are not only rich in calcium but also provide vitamins and minerals essential for overall health. Leafy greens are also low oxalate, which assists in calcium absorption. Chia seeds. These seeds are nutrient-dense powerhouses, rich in calcium, fiber, omega-3 fatty acids, and antioxidants. They offer a versatile addition to various meals, from smoothies to salads. Yogurt. Dairy products like yogurt are traditional sources of calcium. They also provide probiotics, which support digestive health. Opt for unsweetened or low-sugar varieties to maximize health benefits. Sardines. These small, oily fish are not only packed with calcium, due to their edible bones, but also contain omega-3 fatty acids and are a source of high-quality protein. Recommendations for supplementation. For those who may not be able to meet their calcium needs through diet alone, supplementation can be considered, but with careful attention to formulation. Here's how you can approach calcium supplementation. Pairing with D3 and K2. Choose calcium supplements that include vitamin D3 and K2 to ensure proper absorption and utilization. These combinations help guide calcium to the bones and prevent it from depositing in the arteries. Consult healthcare providers. Before starting any supplementation, it's essential to consult a healthcare provider to tailor your approach based on your health status, dietary intake, and specific needs. Monitor intake. Be cautious of the total amount of calcium consumed from both diet and supplements, ensuring that it does not exceed the recommended dietary allowance unless specified by a healthcare professional. While calcium is indispensable for many bodily functions, including bone health, understanding the nuances of its supplementation is crucial for avoiding potential health risks. By incorporating calcium-rich foods and carefully considering supplement options that include vitamins D3 and K2, you can effectively manage and support your calcium intake. This balanced approach helps harness the full benefits of calcium while minimizing associated risks, thereby supporting both bone health and cardiovascular well-being. Navigating vitamin B6 supplementation, benefits and risks. Vitamin B6, also known as pyridoxine, is a water-soluble vitamin critical for numerous physiological functions, including amino acid metabolism, neurotransmitter synthesis, and the production of hemoglobin. It's often included in supplements aimed at promoting nerve health and cognitive function. However, as beneficial as vitamin B6 is, it's important to be cautious about its intake, especially in supplemental form, as excessive consumption can lead to adverse effects. The importance of vitamin B6. Vitamin B6 plays a vital role in several key bodily functions. Nerve function and brain health. It aids in the synthesis of neurotransmitters such as serotonin, dopamine, and GABA, all of which are crucial for mood regulation, mental clarity, and cognitive health. Metabolism. B6 is essential for amino acid metabolism and the breakdown of proteins, which are foundational for energy production and overall cell function. Hemoglobin production. This vitamin is necessary for hemoglobin production, which is critical for oxygen transport in the blood. Due to these essential roles, vitamin B6 is commonly found in nerve health and brain support supplements. The risks of excessive vitamin B6 intake. Despite its importance, too much vitamin B6 can lead to health issues, specifically neuropathy. High doses of vitamin B6 over a prolonged period can accumulate in nerve tissue, leading to neuropathy, damage to peripheral nerves that can cause sensations of numbness, tingling, or burning in the hands and feet. This is paradoxical, given that the vitamin is often used to support nerve health. Enhanced risk for seniors. Seniors may be particularly vulnerable due to slower metabolic rates, which can affect the vitamin's clearance from the body. This increases the likelihood of toxicity if high doses are consumed regularly. Reversible effects. Fortunately, reducing intake usually reverses the neuropathic symptoms, but it's essential to monitor and control intake to prevent the onset of these effects. Safe vitamin B6 intake. To avoid the risks associated with excessive vitamin B6, it's crucial to stay within the recommended daily intake. Recommended safe range. The recommended dietary intake for adults typically falls between 1.5 to 1.7 milligrams per day. This range ensures adequate levels for maintaining bodily functions without reaching toxicity risk. Natural dietary sources. Obtaining vitamin B6 through food is generally safe and effective. Foods high in vitamin B6 include turkey, a lean source of protein that provides a good amount of vitamin B6. Bananas. These fruits are convenient and provide a healthy dose of vitamin B6 along with other nutrients like potassium and fiber. Chickpeas, a versatile legume that not only offers vitamin B6, but also fiber and protein, making it great for vegetarians and vegans. Recommendations for supplementation. If you decide to take vitamin B6 supplements, here's what you should keep in mind. Monitor labels. Always check supplement labels to ensure you're not exceeding the recommended daily intake. B6 is often present in multivitamins and specific formulations, so it's important to add up the total daily amount from all sources. Consult professionals. As with all vitamins, it's prudent to consult with a healthcare provider, particularly if you are considering higher doses for therapeutic purposes or have specific health concerns. Personalized advice can help to tailor your intake to your specific health needs. Watch for symptoms. Be attentive to any signs of neuropathy, especially if taking supplements. If you experience unusual sensations in your extremities, review your intake of vitamin B6 with a healthcare provider. Vitamin B6 is an essential nutrient that supports several crucial bodily functions, from nerve integrity to immune health. However, maintaining it within safe limits is key to leveraging its benefits without risking potential harm. By focusing on a diet rich in varied, whole foods and being mindful of supplement contents, you can enjoy the advantages of vitamin B6 while minimizing the risk of toxicity, supporting both nerve function and overall wellness. Part 2. 4 vitamins and nutrients you should absolutely take after 60. Best vitamin 1. Magnesium, essential for optimal health. Magnesium is a vital mineral that plays a critical role in several bodily functions, yet is often overlooked. It is involved in over 300 biochemical reactions within the body, influencing everything from sleep quality to heart health. Despite its importance, magnesium deficiency is surprisingly common, particularly among older adults. Let's delve into why magnesium is indispensable and how to ensure you're getting enough of this essential nutrient. The role of magnesium in the body. Magnesium is crucial for various key functions. 1. Sleep regulation. Magnesium helps activate neurotransmitters and hormones like melatonin that play a role in calming the nervous system and promoting restful sleep. This makes it a natural aid for improving sleep quality. 2. Heart rhythm. This mineral is fundamental to heart health, as it helps maintain a regular heartbeat. Magnesium facilitates calcium function, which is critical for the contraction and relaxation of heart muscle cells. 3. Nerve and muscle function. It is essential for nerve transmission and muscle contraction, which underscores its importance for overall muscular health and function. Consequences of magnesium deficiency. Without adequate magnesium, the body can encounter several issues. 1. Leg cramps and muscle spasms. These can occur because magnesium is important for muscle relaxation. A deficiency can lead to increased muscle tension and spasms. 2. Anxiety and restlessness. Magnesium influences the body's stress response by helping regulate neurotransmitters that impact mood. Low levels might contribute to increased feelings of anxiety and restlessness. 3. Poor sleep. As previously mentioned, inadequate magnesium can impair sleep quality, leading to difficulties falling or staying asleep. This can result in overall fatigue and reduced daily function. Factors reducing magnesium absorption. Certain factors make magnesium deficiency more pronounced. Medications, diuretics and proton pump inhibitors, PPIs, can deplete magnesium levels. Diuretics increase the excretion of magnesium through urine, while PPIs affect the stomach's ability to absorb magnesium effectively. Aging. The body's ability to absorb magnesium decreases with age. Additionally, older adults often eat less, which can naturally reduce magnesium intake from food sources. Optimizing magnesium intake. To ensure sufficient magnesium intake, consider the following. 1. Supplementation. Choosing the right form of magnesium is important. Opt for Magnesium glycinate, known for its high absorption and gentle effect on the stomach, making it excellent for long-term use. Magnesium citrate, this is also well absorbed and can aid with digestion, often used for its laxative properties. Magnesium malate, often recommended for muscle pain and fatigue. Aim for a daily intake of 250 to 400 milligrams, and always check with a healthcare provider before starting, especially if you're on medication or have health conditions. 2. Dietary sources. Incorporating magnesium-rich foods into your diet is a natural way to boost intake. Spinach, a leafy green rich in magnesium, also provides fiber, iron, and multiple antioxidants. Almonds, a convenient snack loaded with magnesium, healthy fats, and vitamin E. Avocados, these contain magnesium along with healthy fats, fiber, and potassium. 3. The consistency is key. Consistent daily intake, whether through diet or supplements, is crucial for maintaining optimal magnesium levels in the body. Magnesium is a multifaceted mineral vital for numerous physiological functions, from promoting restful sleep to supporting heart health. With the challenges of aging and medication use potentially disrupting magnesium levels, staying mindful of your intake can help mitigate deficiency risks. By choosing the right supplements and enriching your diet with magnesium-rich foods, you can safeguard your health and enhance overall well-being. Best vitamin 2, vitamin D3, essential for health and vitality in seniors. Vitamin D3, while commonly referred to as a vitamin, is technically a hormone crucial for maintaining several aspects of health, particularly in older adults. It influences immunity, bone health, and brain function, making it indispensable for overall well-being. However, as we age, our body's ability to produce vitamin D3 decreases, which can lead to a host of health issues. Let's explore why vitamin D3 is crucial and how to maintain adequate levels as we get older. The critical roles of vitamin D3. Vitamin D3 serves multiple essential functions in the body. 1. Immune support. Vitamin D3 plays a pivotal role in modulating the immune system. It enhances the pathogen-fighting effects of monocytes and macrophages, crucial white blood cells, and decreases inflammation. 2. Bone health. This hormone facilitates calcium absorption in the gut, which is vital for maintaining strong and healthy bones. Without adequate vitamin D3, there's an increased risk of bone-related disorders such as osteoporosis. 3. Brain and cognitive function. Vitamin D3 receptors are present in areas of the brain that are key for behavior and cognition. Adequate levels are linked to mood regulation and cognitive health, potentially reducing the risk of mood disorders and cognitive decline. Challenges with vitamin D3 production in seniors. 1. Reduced skin synthesis. After age 60, the skin's ability to synthesize vitamin D3 from sunlight significantly diminishes. This decline means less natural production, making supplementation often necessary to maintain optimal levels. 2. Lifestyle factors. Aging adults may spend less time outdoors or have decreased mobility, further impacting sunlight exposure necessary for vitamin D3 synthesis. Health implications of vitamin D3 deficiency. Lacking sufficient vitamin D3 can lead to several health issues. 1. Falls and fractures. Deficiency is linked to an increased risk of falls, particularly due to weakened muscle function and bone health, making seniors more susceptible to fractures. 2. Infections. A weakened immune response can lead to a higher susceptibility to infections, as vitamin D3 deficiency impairs the body's ability to effectively combat pathogens. 3. Mood and cognitive issues. Insufficient vitamin D3 levels are associated with mood disorders such as depression and cognitive issues, including memory loss and cognitive decline. Recommended dosage and supplementation. To ensure adequate vitamin D3 levels, consider the following guidelines. 1. Dosage. Most seniors should aim for 1,000 to 2,000 IU per day, depending on individual health needs, lifestyle, and advice from healthcare providers. Regular blood tests can help tailor the right dosage. 2. Type of supplement. It's essential to choose vitamin D3, cholecalciferol, over D2, ergocalciferol, as D3 is more effective at raising and maintaining adequate vitamin D levels in the blood. 3. Pair with healthy fats. Since vitamin D3 is fat-soluble, taking it with food containing healthy fats improves absorption. Foods like avocados, nuts, and olive oil are excellent options to pair with your supplement. Practical tips for optimizing vitamin D3 intake. Sun exposure. When possible, spend short, regular periods in sunlight, especially in the morning or late afternoon when UV rays are less intense. Even this limited exposure can contribute to vitamin D3 synthesis. Dietary sources. While not as potent as supplementation, including vitamin D-rich foods in your diet can be beneficial. Fatty fish like salmon, fortified dairy products, and egg yolks are all good sources. Monitor levels. Regularly monitor your vitamin D levels through blood tests, especially if you suspect deficiency symptoms, to ensure they are within an optimal range. Vitamin D3 is a powerhouse hormone essential for maintaining immunity, bone health, and cognitive function, especially in the elderly. Due to the natural decline in production as we age, supplementation is often necessary to fulfill daily needs. By taking the right type and dosage of vitamin D3 and pairing it with dietary fats, seniors can effectively support their health and maintain an active, vibrant lifestyle. Always consult with a healthcare provider to find the most suitable regimen for your specific health needs. Best vitamin 3, vitamin B12, a crucial nutrient for seniors. Vitamin B12, also known as cobalamin, is essential for several vital functions in the body, particularly concerning brain health, nerve function, and the production of red blood cells. As we age, vitamin B12 absorption becomes increasingly compromised due to changes in digestion and metabolic processes, making it a common deficiency in the elderly. Understanding the importance of vitamin B12 and how to maintain proper levels is key to sustaining health and well-being. Key functions of vitamin B12. Vitamin B12 plays several critical roles in the body. 1. Brain function and memory. Essential for the production and maintenance of myelin, the protective sheath around nerves, vitamin B12 optimal brain function and cognitive health. Adequate levels are associated with retention and mental clarity. 2. Balance and nervous system health. It is crucial for nerve signal transmission, impacting balance and coordination. Low levels of vitamin B12 can lead to nerve damage, affecting movement and stability. 3. Red blood cell production. Vitamin B12 aids in the formation of red blood cells, which are crucial for transporting oxygen throughout the body. Without sufficient B12, red blood cell production can decrease, leading to anemia and resultant fatigue. Challenges with vitamin B12 absorption in seniors. As individuals age, their ability to absorb vitamin B12 diminishes. Decline in stomach acid. Adequate stomach acid is necessary for freeing vitamin B12 from food. With age, the production of stomach acid typically decreases, reducing the ability to extract and absorb this crucial vitamin effectively. Common symptoms of deficiency. Lack of vitamin B12 can manifest in a variety of symptoms, including fatigue, a general feeling of tiredness and low energy levels. Tingling and numbness. These sensations, especially in the hands and feet, can occur due to nerve damage. Walking difficulties and balance issues. Coordination and stability may be compromised. Confusion and cognitive impairment. Memory lapses and confusion may become more frequent. Optimal vitamin B12 supplementation. To counteract dietary absorption issues, consider these supplementation strategies. 1. Dosage. Older adults may benefit from a daily intake of 500 to 1,000 micrograms of vitamin B12, tailored according to their specific health requirements and levels of absorption. 2. Supplement forms. Sublingual methylcobalamin. This form is readily absorbed under the tongue, allowing for direct entry into the bloodstream, which bypasses some digestive barriers. Cyanocobalamin, another effective form that, while requiring conversion in the body, is often more readily available and can be equally effective for many people. 3. Regular monitoring. Having regular blood tests is essential to monitor vitamin B12 levels, particularly if you experience symptoms of deficiency or are at higher risk due to age or dietary restrictions. Practical tips for ensuring adequate vitamin B12. Dietary sources. While supplementation is often necessary, incorporating foods rich in vitamin B12 can complement your regimen. These include animal-based products such as meat, fish, dairy, and eggs. Consult healthcare professionals. It's crucial to have a healthcare provider assess your B12 status through blood tests and recommend an appropriate supplementation strategy. Integrated approach. Combining dietary adjustments with effective supplementation can create a comprehensive strategy to maintain optimal B12 levels. Vitamin B12 is fundamental for maintaining neurological function, cognitive health, and the production of healthy red blood cells. With age-related declines in absorption, it's particularly important for seniors to be vigilant about their B12 status. By opting for sublingual supplements and maintaining regular checkups, older adults can effectively manage their vitamin B12 levels, enhancing overall health and quality of life. Always consult with a healthcare provider to identify the best approach tailored to your unique needs. Best vitamin 4, omega-3 fatty acids EPA+ DHA, vital for longevity and health. While not classified as a vitamin, omega-3 fatty acids are crucial for maintaining health, especially in seniors. These essential fatty acids, particularly eicosapentaenoic acid EPA and docosahexaenoic acid DHA, play key roles in building brain tissue, protecting heart health, and reducing inflammation. Despite their importance, many older adults do not get enough omega-3s through diet alone, necessitating supplementation for optimal health outcomes. The importance of omega-3 fatty acids. Omega-3s are indispensable for several reasons. 1. Brain tissue development. DHA is a major structural component of the brain and retina, critical for maintaining cognitive function and visual health. It supports neurogenesis and synaptic plasticity, crucial for learning and memory. 2. Heart protection. EPA and DHA contribute to heart health by lowering triglyceride levels, reducing blood pressure, and preventing arrhythmias. They help in keeping the arteries flexible and reducing the risk of heart disease. 3. Inflammation reduction. Omega-3 fatty acids possess powerful anti-inflammatory properties, beneficial in managing chronic inflammatory conditions like arthritis and supporting overall immune function. Widespread omega-3 deficiency. Despite their benefits, most seniors fall short on omega-3 intake due to dietary limitations. Many older adults do not consume sufficient fatty fish, such as salmon, mackerel, and sardines, that are rich in EPA and DHA. This often results from dietary preferences, availability, or dietary restrictions. Health risks of deficiency. Inadequate omega-3 intake is linked to increased inflammation, heightened risk of cardiovascular disease, cognitive decline, and other age-associated health issues. Effective omega-3 supplementation. To address omega-3 deficiencies, consider these supplementation guidelines. 1. Supplement choices. Purified fish oil. Look for pharmaceutical-grade options that are tested for purity and free from contaminants like mercury, dioxins, and PCBs. Algae-based omega-3s, a great plant-based alternative for those who prefer not to consume fish products. Algae oils provide a direct source of DHA and are environmentally sustainable. 2. Dosage goals. Aim for a daily intake of 1,000 to 2,000 milligrams of combined EPA and DHA. This range is effective in supporting heart health, cognitive function, and reducing inflammation. 3. Clinical benefits. Studies link adequate omega-3 intake to a 36% reduction in the risk of death for people over 60, underscoring their potential impact on longevity and overall health. Practical tips for optimizing omega-3 intake. Incorporate fatty fish. When possible, include fatty fish in your diet at least twice a week to naturally boost your omega-3 levels. This offers additional nutrients beneficial for health. Read labels carefully. When choosing supplements, check labels to ensure the EPA and DHA content meets your desired dosage. Also, verify product quality and purity. Consult with a healthcare provider. Before beginning any new supplementation regimen, it's wise to discuss with healthcare providers, especially if you have existing health conditions or are taking medications that could interact with omega-3s. Omega-3 fatty acids are essential supernutrients that support brain, heart, and overall health, particularly benefiting seniors whose dietary intake may be insufficient. With their capacity to lower risks of chronic diseases and improve longevity, omega-3s are a vital component of a healthy aging regimen. By choosing the right supplements and integrating natural sources like fatty fish, you can enhance your omega-3 intake significantly, promoting well-being and vitality in the later years of life. Part 3. Bringing it all together. Now that you're armed with knowledge about essential nutrients,